Well, good afternoon. I'd like to welcome you today to our seminar. This is a seminar sponsored by the InfoNet Project and the Waterloo Institute for Health Informatics Research. And we are delighted today that Jean-Marie Berthelot is going to be our guest speaker. One announcement before we introduce the speaker. Our next seminar is Wednesday, and I'm going to get the date correct this time. Wednesday, March 24th. And it is our pleasure to announce that the Honorable Horace Creever will be our guest speaker. So I'm sure that everybody will want to come and hear him speak next month. So without any further ado, I'd like Dominic to introduce our speaker.
I didn't really know Jean-Marie before this, as he knows. It was kind of interesting. I was talking to George Torrance at McMaster University about our seminar series, and all of a sudden he's recommending Jean-Marie to me, and I figured anything that George recommends to me I better consider, because I worked with him quite a few years. He's former dean of business school at McMaster University. So I figured anybody he feels strongly about I should consider. We talked to Jean-Marie, and he just about convinced me that what he was doing wasn't quite what we were interested in. It was quite interesting. I stood back and I thought about it for a while, thought of what George said, and I got him back on the phone and said, "Are you sure?" Anyway, I think it's of incredible importance to us in a different area that we're not doing enough about. So hopefully he's the start of a number of speakers in this area. Jean-Marie is the manager of Health Analysis and Modeling Group at Statistics Canada. He's directing research projects in health economics, population health, and health services research. He's an expert in the area of generic health status measures, which is of great interest to me, and their use in monitoring population health. We have a very strong presence, as you know, in that area, in applied health sciences, and I'm sure that the material here will be of interest to them. What's interesting to me, too, is another area of expertise is in record linkage. The ability to bring records together. It used to be just birth and death records, where the names and dates of birth may vary and yet have a probabilistic union of those two records. Very important in the area of any kind of matching of patients where you don't have a unique identifier. And that's true in Canada, generally. That's the root of a lot of what are called enterprise master patient index systems. He's the principal investigator for the baseline indicators of mortality for monitoring health disparities project. Talking about that at lunch. In 2001, he received McMaster University's Labelle Leadership, awarded to a young investigator engaged in multidisciplinary health services research who is challenging existing methods or accepted ideas in health services. I'm looking forward very much to your talk, Jean-Marie, and welcome to you.
Thank you.